Chest pain is a common symptom that can have serious underlying causes. Two types of chest pain that are commonly seen in clinical practice are stable angina and unstable angina. While both are caused by decreased blood flow to the heart, they have different presentations and require different management strategies. In this video, we will explore the causes, symptoms, diagnosis, and treatment options for both stable and unstable angina. By the end of this video, you will have a clear understanding of the key differences between these two conditions and be better equipped to recognize and manage them in your clinical practice. Stable angina and unstable angina are two types of chest pain caused by inadequate blood flow to the heart. The main difference between the two is the predictability of symptoms and the risk of a heart attack. Stable angina is typically caused by a buildup of plaque in the coronary arteries that restricts blood flow to the heart. It occurs during periods of exertion or stress and is relieved with rest or medication. The underlying pathology involves partial blockage of the coronary arteries, resulting in reduced blood flow to the heart. Stable angina is not a medical emergency, but rather a warning sign that the heart is not receiving enough oxygen-rich blood. Treatment may involve lifestyle modifications, medication, and possibly revascularization procedures such as angioplasty or bypass surgery. Unstable angina, on the other hand, is a medical emergency and requires immediate attention. It occurs suddenly, even at rest, and may be more severe and last longer than stable angina. Unlike stable angina, unstable angina may not be relieved with rest or medication. The underlying pathology involves the rupture or erosion of plaque within the coronary arteries, leading to the formation of a blood clot that partially or completely obstructs blood flow to the heart. Unstable angina is a sign of an impending heart attack and requires hospitalization and treatment with antiplatelet drugs, such as aspirin, and sometimes angioplasty or bypass surgery. An example of a typical patient with stable angina is an older adult with a history of hypertension, high cholesterol, and a sedentary lifestyle. They may experience chest pain or discomfort during exercise or physical activity that is relieved with rest or nitroglycerin. An example of a typical patient with unstable angina is someone who presents to the emergency department with sudden onset chest pain that is severe and not relieved with rest or medication. They may have a history of prior heart disease or risk factors for heart disease, such as smoking or diabetes. Diagnosis of stable and unstable angina involves a thorough medical history, physical examination, and diagnostic tests such as electrocardiogram, ECG, stress test, and coronary angiography. It is important for medical professionals to be able to distinguish between the two conditions, as prompt and appropriate treatment can prevent further damage to the heart and potentially save a patient's life. Now let's put that knowledge to the test. Which of the following is the primary difference between stable angina and unstable angina? A. The severity of chest pain. B. The presence of underlying atherosclerosis. C. The pattern of chest pain. D. The presence of Saint segment elevation on EKG. Answer: C. The pattern of chest pain. In stable angina, chest pain typically occurs during exertion and is relieved with rest or medication. In unstable angina, chest pain is unpredictable and can occur at rest or with minimal exertion. In conclusion, stable angina and unstable angina are two types of chest pain that are caused by decreased blood flow to the heart. Stable angina is typically brought on by physical activity or stress, while unstable angina occurs at rest and is often a sign of an impending heart attack. The diagnosis of angina is based on the patient's symptoms, medical history, and physical exam, as well as additional diagnostic tests such as electrocardiogram, stress test, and angiography. Treatment for angina includes lifestyle modifications, medication, and in some cases, invasive procedures such as angioplasty or coronary artery bypass surgery. By understanding the key differences between stable and unstable angina, healthcare providers can provide prompt and appropriate care to their patients with chest pain, potentially preventing serious cardiac events. Like, comment, and subscribe.